births are paid for by Medicaid. You want to have a discussion about our entitlements? 40% of all births in this country are paid for by Medicaid. And what we're having trouble with right now, sorting through, because the media is always in the room and we're trying to get our answers right, even on something as critical as immigration. If it's comprehensive, I don't want it anymore, especially when you hear what happened with Obamacare, that we have to get the no after it's passed. We don't want it comprehensive, because included in this 40% of all births paid for by Medicaid are people who are born on American soil, regardless of how they got here. And Medicaid pays the bill of 60% of all long-term nursing home care. It's not just the babies, it's womb to tomb. 60% of all long-term care in this country is paid for now by Medicaid. And the interesting thing is they put the Medicare, Medicaid, and Social Security together. Now, all of them have issues, but the difference between Medicaid and Medicare and Social Security is that Medicare and Social Security, people have skin in the game. They've been investing over their working lives. So we have interest in making sure that we get that right. But Medicaid, the people paying the bill are not the ones taking advantage. What we know about Medicaid is that it's so corrupted with government intrusion that doctors don't accept it. So what do we know about Medicaid? Is any type of specialist is not going to go into the hardest hit of our communities where they really need doctors most to tell them how to live, because obviously they don't have the instruction, or obesity wouldn't be the #1 issue, and or diabetes, and some of the more simpler problems that you self-inflict and are much more complicated as you leave it unchecked. They don't have these specialists, so they go into the emergency room to get all of their health care at the time that they need to see someone. And they know that that's where the doctors are. And we think, oh, well, if we change that by having Obamacare and more government intrusion, then they'll just automatically start going into private sector. There's no private sector in these communities, #1. And #2, it's in the culture of the people that are on Medicaid now to go where the specialists are. Go where you know that if I go in, even though I've been sick for a long time, they're not going to let me out until they find out what's wrong with me. It's a one-size-fits-all shop that they are accustomed to because of the entitlement mentality that has plagued their communities for the last 50 years. Entitlement, Medicaid, Medicare, Social Security, $1.4 trillion annually is what we spend. $80 trillion estimated unfunded liability. 10,000 folks turning 65 a day. We have things we need to talk about yet as Republicans in this society. We need an opposition force in our country. Our current national debt is $16 trillion, with a deficit more than $1 trillion a year. And when they started saying, well, they're just a party of no, we should say thank you. Somebody ought to say no.
GrokTV.